We have a story today that sits right at that wild intersection of Hollywood buzz, new medicine, and what people are actually experiencing.
Yeah, it started online, kind of under the radar, but a term popped up that's now been, well, confirmed by some pretty high-profile names,
Welcome to Starscope Report.
where we dig into the stories making noise in Hollywood, music, and pop culture.
Today we're talking about a consequence of those GLP-1 weight loss drugs.
Yeah.
Ozempic, Wegovy, that wasn't in the clinical trials. It's something patients noticed first.
And the term they coined is definitely attention-grabbing. Ozempic Vulva. It parallels Ozempic Face, which most people have heard about by now.
Exactly. So our mission today is to dive deep. How did this term jump from, anonymous online forums to celebrity podcasts, forcing the medical world to actually respond?
And crucially, we need to understand why this is happening. We'll break down that it's not some weird side effect, but actually a consequence of the drug doing its job maybe a bit too quickly.
Okay, so let's trace this back. How did Ozempic Vulva go mainstream? Seems like celebrities played a big role.
Absolutely. The real catalyst seems to have been comments made by Dr. Terry Dubrow, the plastic surgeon from Botched, and his wife, Heather Dubrow, on their podcast.
Right. Small dose, big talk. What exactly did they say?
Well, Heather initially brought up a concern about fullness in the pubic area. She used the term fat vulva, I think.
Okay.
But then Dr. Dubrow stepped in, clarified the anatomy. It's the mons pubis she was referring to, but then he pivoted. He confirmed the opposite issue is what's being noticed.
The opposite, meaning loss of volume.
Exactly. He said the Ozempic vulva, using that term, is a thing. He described it as looking flat, flabby, or sort of deflated because the fat underneath shrinks rapidly.
Wow. So a celebrity doctor confirming this patient-coined term really gave it legs.
It's a fascinating information pipeline, isn't it? From anonymous Reddit threads, maybe, to a celebrity podcast, and boom, it lands in the mainstream conversation.
It sort of forces clinicians to address something that hasn't gone through the usual slow peer review process yet.
Precisely. And that creates this tension. On one side, you have people saying, stop the Ozempic shaming, respect patient privacy, which is valid.
Of course.
But on the other side, if we just ignore these terms because they sound a bit crude or they originate online, we miss really important clues about the drug's broader effects. Not just cosmetic, but functional too.
So we need to talk about it, but maybe find a way past the slang to get to the actual science without dismissing the patient experience.
That's the balancing act. How do doctors talk about this using language patients understand without making them feel unheard or, alienated?
Okay, let's try to bridge that gap now. Deconstruct this Ozempic vulva phenomenon. You mentioned it's part of a bigger set of terms.
Yeah, it fits right in with Ozempic face, Ozempic butt, even Ozempic breasts. It's this whole lexicon that patients have created to describe the aesthetic changes they're seeing with rapid weight loss from these drugs.
But crucially, these aren't official medical diagnoses, right?
Not at all. They're colloquial labels for observable physical changes.
So the name itself, Ozempic Vulva, is a bit misleading then. It sounds like the drug is directly doing something to that specific area.
That's the key misnomer, and you can see why people might think that, given the name. But the scientific agreement is really clear on this. It is not a direct pharmacological side effect.
Okay, so what is it?
It's a secondary consequence. It's a cluster of changes that happen because of the rapid overall systemic weight loss that the GLP-1 drug helps achieve. The drug works on appetite and stomach emptying, leading to fast fat loss everywhere.
So aesthetically, that means volume loss.
Primarily, yes. The labia majora, the outer lips, and the mons pubis, that area above, they lose their underlying fat padding, so they can look deflated, hollowed out, even older.
And then the skin gets loose.
Right. Volume loss is followed by skin laxity. The skin was stretched before, and now the support structure is gone quickly, so it sags or wrinkles. It's just like loose skin you might see on someone's arms or belly after significant weight loss.
Okay, that makes sense cosmetically. But you mentioned functional issues. What takes this beyond just appearance? What are people actually experiencing?
This is where it gets really important from a quality of life perspective. We're hearing reports of vulvar dryness, sometimes chronic irritation.
Okay.
And significantly, some patients describe a feeling of pelvic floor weakness or vaginal laxity.
Weakness. How does that happen?
Well, losing that underlying tissue support, potentially combined with muscle loss, which we'll get into, can weaken the whole structure. And that can directly cause stress urinary incontinence.
You mean like leaking when you cough or sneeze or laugh?
Exactly that.
Hmm.
And another thing, losing those fatty pads in the labia majora, that's your natural cushioning.
Right.
Without it, activities like cycling, running, maybe even just sitting for a long time can become uncomfortable or even painful due to friction. It's a real physical problem.
Okay, so let's connect the dots here. You drew the parallel with Ozempic Face, earlier the gaunt look from losing fascia fat pads.
Yes, it's fundamentally the same mechanism. Understanding that helps break down the why into, let's say, 4 main pillars or mechanisms driving these vulvar changes.
Right, what's pillar number 1?
Mechanism 1 is the most straightforward. Global fat loss.
Yeah.
Simple as that. The vulva, specifically the mons and labia majora, is largely made of fatty tissue. When you lose weight systemically, your body pulls fat from everywhere. It doesn't pick and choose, so that area just deflates.
Makes sense. What's number 2?
Number 2 is tied to the speed of the weight loss. Collagen and skin laxity. If someone carried extra weight for a while, their skin was stretched, collagen and elastin fibers might already be damaged. When the weight drops off really fast, like it often does with these drugs, the skin just doesn't have time to shrink back, to remodel itself, so it sags.
Right, not enough time to snap back. Okay, pillar 3.
This one's crucial for the functional issues, like incontinence, lean muscle loss, and the pelvic floor. This is a big one. Research suggests that with rapid weight loss, especially just through calorie restriction, up to 40% of the weight loss can actually be lean tissue muscle.
40%. Wow, that's a lot.
It is, and that muscle loss is systemic too. It affects the complex muscles of the pelvic floor, which are vital for support incontinence. Weakening them directly contributes to laxity and leakage. This might be especially relevant for, say, older women.
Okay, systemic fat loss, skin laxity, muscle loss. What's the 4th pillar?
Number 4 involves secondary metabolic effects, which actually loops back to the known side effects of the GLP-1 drugs themselves.
How so?
While common side effects listed on the label include nausea, vomiting, diarrhea, these can lead to dehydration.
Oh, okay.
And dehydration affects all your mucous membranes, including vaginal and vulvar tissues, making dryness and irritation worse.
I see. Anything else metabolic?
There's also a potential link to hormones. Fat tissue actually plays a role in converting certain hormones, like androgens, into estrogen. So losing a lot of fat quickly could potentially lower circulating estrogen levels.
And estrogen is important for vaginal health.
Absolutely vital. It maintains tissue thickness, elasticity, lubrication down there. So a dip in estrogen could contribute to dryness and tissue thinning.
So we have these 4 pretty clear mechanisms explaining what's going on: fat loss, skin issues, muscle loss, and these secondary effects like dehydration or hormonal shifts.
Right, a multi-pronged explanation.
Yet if you look at the official drug information from the FDA or European agencies, you won't find vulvovaginal changes or skin laxity or muscle loss listed as direct side effects. Why aren't they there?
It really comes down to how clinical trials are designed and what they prioritize. They focus mainly on statistically significant adverse events related to safety, things like pancreatitis, kidney problems, thyroid issues, major organ stuff.
Things that show up relatively quickly and affect core health.
Exactly. Aesthetic changes or more subtle quality of life impacts like these, which are secondary consequences of the drug working, causing weight loss, tend to emerge later when millions of people are using the drug in the real world. That's post-market surveillance.
Which is basically what's happening now, fueled by patient reports and social media.
Precisely. We're getting that real-world data now.
But the key point for anyone listening is that experts, gynecologists, plastic surgeons, endocrinologists, they generally agree on the cause, right? It's a consequence of the weight loss itself.
Yes, the consensus on the mechanism is solid, and because it involves skin, fat, potentially muscle, and function, it really calls for a team approach, much like we see in post-bariatric surgery care.
So the good news is there are ways to manage this. It's not something people just have to live with.
Definitely not. There are strategies. Ideally, prevention is best. Trying to achieve more gradual weight loss, maybe aiming for 1 to 2 pounds a week, could give the skin more time to adjust.
Okay, slow and steady.
And critically, anyone on these drugs needs to focus on high protein intake and resistance exercise. Strength training. That's crucial to fight that lean muscle loss, especially for preserving the pelvic floor.
Right, protect the muscle mass. But what if someone's already experiencing these issues? What helps then?
For the functional problems, the laxity, the incontinence pelvic floor physical therapy is key. A specialized therapist can design exercises way beyond basic Kegels to strengthen those muscles.
And for the dryness or irritation?
Topical treatments can help a lot. That could be specific vulvovaginal moisturizers or, in some cases, topical estrogen therapy to restore tissue health and lubrication.
Okay. And what about the aesthetic side, the volume loss, if that's the main concern for someone?
There are cosmetic solutions borrowing directly from facial rejuvenation techniques. For volume, options include things like labia puffing using dermal fillers, or even fat grafting, taking fat from elsewhere on the body and injecting it there.
Like filling in the deflation.
Exactly. And for skin tightening, energy-based devices are being used. Things like radiofrequency microneedling can help stimulate collagen production to firm things up a bit. These are established cosmetic procedures finding a new application here.
So, wrapping this up, the big takeaway seems to be that Ozempic Vulva, despite the provocative name, isn't some bizarre drug reaction.
Not at all. It's a predictable, understandable consequence of doing what the drug is supposed to do, helping achieve significant, often rapid weight loss.
And reframing it that way as a consequence, not a failure, is key for productive conversations between patients and doctors. It allows for informed consent before starting the drug and better management if issues arise.
Absolutely. Anticipating and managing these kinds of aesthetic and functional consequences needs to be part of the whole package when prescribing these powerful medications. It's about treating the whole person, not just the number on the scale.
And at least one final thought, maybe a provocative one for you to consider. The sheer speed at which this term, Ozempic Vulva, went from online chatter to mainstream clinical discussion. It really highlights something about medicine in the digital age, doesn't it?
It certainly does.
Social media, for all its flaws, is acting like this incredibly fast, real-time, patient-driven feedback loop, maybe even a surveillance system. It's pushing the medical world to acknowledge and understand the full spectrum of effects of new treatments much, much faster than traditional methods ever could.
That's a powerful point. It makes you wonder what other subtle changes, maybe related to quality of life, are being discussed by patients right now, using their own terms, just waiting for the medical community to catch up and really listen.
You've been listening to Starscope Report, where Jordan and Jamie uncover the stories shaping Hollywood, music, and pop culture. Thanks for tuning in, and we'll catch you next time.